I always wanted to help people. And what's the best way to help people if not their health? Health is wealth. And I've seen a lot of sickness around me, and there was no doctor in my family. So I used to take my family members to the doctors a lot. And there I kept on getting impressed by their behavior, by their knowledge. So I thought, I do want to get into medicine and be the first doctor in my family and help everyone around me. So even in high school, I found that I was really intrigued by the hormones and the feedback pathways. And then when I came to the States for internal medicine training, I saw there was so much obesity and diabetes around. And so this is the realm of endocrine. So obesity is very dangerous in the sense that it is a disease in of itself, but it also contributes to other diseases. Like number 1 is hypertension. Number 2 is diabetes. Number 2 is joint pains, arthritis, back pain, sleep apnea. There are 200 plus diseases which happen because of obesity. So instead of treating piecemeal, you just have to attack obesity first. There's the root cause. Nobody wants to be big. Okay. The American food industry has failed the people. All of them. Because obesity rates have gone up to 42% in the country, right? And nobody wants to be big. It's because of the environment that has been created around them. In the face of stress, busy lifestyle, many other psychosocial issues, it's this complex interplay that only in the past 70 years, post-World War II, these obesity rates have been going up. And it should involve changes in policies, health policies, food industry, access to medicine and health. And yeah, there are many variety of things which need to be changed. There are 5 pillars. Number 1 is always behavioral. First is, are you ready to make that change or not? Because unless you're mentally ready to make the changes, nobody can make you lose weight or make you do anything, right? So number 1 is behavioral. Next is eating. Learning about what to eat, what not to eat, how much to eat. That's a skill. Next is activity. We don't talk about exercise because even during our normal days, we don't need to exercise, but we can complete 10,000 steps. So increasing activity in any way you can. The 4th pillar is M, medications. Everybody thinks medications is number 1. It is not, because the BEA, behavioral, eating, and activity, they form the lifestyle. And after that, you do the medication part, they go hand in hand. So appropriate medicines, and next is surgery, bariatric surgery or endoscopic procedures in the right kind of patient. In the society, there's a lot of stigma and bias against patients with weight. And these patients have suffered all this stigma and they have their own guilt internalized. And many of them find it difficult to reach out to specialists like us to actually ask for help with obesity. I think that's the most difficult part. But in my clinic, there's no place for stigma or bias because I know what are the causes of obesity. And I just focus on them and just help patients reach their weight goal.